So I have been charged with the task of going over exercise and sports guidelines for pediatric cardiomyopathy, which I acknowledge is a broad topic. My background is that I am interested in both cardiomyopathy as well as exercise physiology, and so potentially I'm well suited to try to attack this topic, but I think there's a lot to be learned, as I'll show with you. So we'll go over importance of exercise, relative levels of activity, and then talk about how we prescribe exercise based on cardiomyopathy type. So we know that some degree of exercise is good for everyone, including those with cardiomyopathy. I don't have to tell you the numerous benefits that it improves skeletal function, it decreases your risk of acquired heart disease, and it can have psychological well-being associated with it. And I think the second point of, patients that are born with cardiomyopathy or develop cardiomyopathy, that might not be something that you can prevent, but you can prevent the secondary acquired heart disease and should be a focus to try to keep your heart as strong as possible. However, we acknowledge that although the American Heart Association tells us to have children exercise for 60 minutes a day, moderate to vigorous aerobic activity, we also are told that, well, your child has a cardiomyopathy, and this gives a kind of mixed message to parents on how do they dictate or go through this process of what's appropriate or safe for their child or for themselves. So I want to go over, just try to demystify a couple words that we use when we're thinking about prescribing different types of exercise. So when we break down exercise, we think of it as low intensity, moderate intensity, or high intensity or vigorous. And we do this because the guidelines, which I'll discuss, help to say which type of exercise is appropriate for each type of cardiomyopathy. So there are far more scientific ways based on how much metabolic work your body is doing when we do a full exercise stress test. But a general rule of thumb that one of my mentors taught me was low intensity, you can easily sing throughout the activity that you're doing. Moderate intensity means that you can still talk in full sentences, but in high intensity exercise, you cannot easily talk in full sentences while doing the sport. Additionally, we have these categories that are important to think about when deciding what type of exercise you're going to participate in. So we talk about physical activity, recreational sport, and competitive sport. So physical activity is defined as any active body movements that result from musculoskeletal contraction and increase your metabolic rate by 6 times. Recreational sport are activities that are performed without pressure to play, without pressure to continue playing for longer or higher intensity than you desire, versus competitive sport, where there's an emphasis or pressure to train at a high intensity, regardless of whether desired or self-directed. And so when we think about these sports, thinking about there are many recreational sports that you can participate in and be physically active without it falling into the competitive sport category. So why does this matter? Well, when we're talking about what type of exercise we can recommend for our patients, it's based on guidelines. And the guidelines discern between recreational activity and competitive activity. Now, to just demystify, what are guidelines? So guidelines are written by experts in the field, and they use all the available information that's been published on a subject, and between what we know as evidence or fact, in combination with expert opinion, these guidelines are developed. Unfortunately, in the world of pediatric, and especially pediatric cardiomyopathy and exercise, the level of facts or evidence that are available are more limited. But hopefully, as I'll show you, there's more data coming out as we speak, trying to guide these or help to develop guidelines so we can make sure we're giving the best advice. So one of the first questions that can come up are activity restrictions or recommendations different between what we tell children and what we tell adults? And generally speaking, as I've said, because data is more limited and as far as exercise and cardiomyopathy, the answer is no. The current guidelines do not discern between a child with cardiomyopathy and an adult with cardiomyopathy. That's particularly true for competitive sports. But for recreational sports, actually the guidelines that are published for activity are directed towards children. So that's the one area where kids are finally kind of beating the adults as far as the evidence guidelines. But that being said, there's evolving guidelines coming out for different types of cardiomyopathy. So when we talk about, we know it's been reviewed many times this morning that there are various types of cardiomyopathy, and the type of exercise that we recommend is tailored to the type of cardiomyopathy that you have. And then lastly, I want to bring up, there's this entity called athlete's heart that maybe you've heard of before, and I just wanted to demystify that as well. So athlete's heart is an entity that's distinct from cardiomyopathy, and it occurs as a result of the heart's accommodation to different levels of exercise. And so when we think about endurance sports, so examples being swimming or running, the heart will actually increase the size or volume. And so every time it pumps, it actually can deliver more cardiac output. And an example of this is Lance Armstrong, whose cardiac output is tremendously higher than an average human. And with that result, because the heart can dilate as a physiologic response, the squeeze may not be as vigorous. So the heart may have entities similar to a dilated cardiomyopathy. Contrast that to sports of strength, so wrestling or weightlifting have different effects on the heart. They can cause the heart walls to be thicker, but the size of the heart tends to remain more stable, and the function of the heart tends to remain stable. And then there are sports that have components of both, and so you can have mixed effects on the heart. And so when we see, as you can see the diagram, the top diagram shows more of these endurance sports changes on the heart. The bottom are more of the strength changes on the heart. And so when we're looking at making sure we have the correct diagnosis for a patient coming in with new concern for cardiomyopathy, this is always on our minds. And one of the ways that we try to rule this out is by placing athletes on a period of exercise restriction for 3 months, and then we compare what their hearts look like at baseline and what the remodeling of the heart looks like afterwards to see if it goes back to more of a normal phenotype or normal appearance. So next, as I said, we do talk about, when we're thinking about exercise recommendations, we do try to tailor them somewhat to different types of cardiomyopathy. But as I'm sure you are aware, there's a lot of overlap in cardiomyopathy, and left ventricular non-compaction is one of those in particular that can have features of being dilated, restrictive, or hypertrophic. And so we can't just keep them in clear buckets. But generally speaking, when we as providers are counseling our patients, when we have a patient that does have left ventricular non-compaction, when we're thinking about can we recommend competitive sports or recreational sports, the first being competitive sports, and generally speaking, we can say yes. But they have to meet certain criteria. And so that's why working with your provider, it's very important to have routine follow-up because we go through and we do an assessment of how your cardiomyopathy is at this point in time and how it's evolving to make sure that it still is what we consider safe to participate. So when we're going through our evaluation, every time we see you or see your child, we're asking about symptoms of heart failure, as Dr. O'Connor has reviewed. We're evaluating the size and the squeeze of the heart. It's really most important to look at how the heart is squeezing. We can do that by echo or cardiac MRI. We want to look for arrhythmias to see if there's any arrhythmias that could be increased during periods of exercise, and we do that by asking you to wear a Holter monitor for 24 hours or a monitor for even longer than that, an EKG, as well as performing an exercise stress test as kind of a snapshot to say, Okay, in this monitored setting, when we push you to full exertion, what does your heart do? Does it show us any signs that it could be at risk for developing abnormal heart rhythms? And then one of the specific symptoms we ask about are periods of passing out, especially for unknown reasons, as that could be a red flag that there could be something more dangerous. So if those criteria are met, then we generally do say it's okay to participate in competitive sports, although this is a spectrum, and so kind of weighing, well, if there's a slight decrease in function, it's a counseling and discussion with your provider. However, when we talk about recreational sports, where children are allowed to take breaks as they want and are not being pushed beyond exertion, generally speaking, we say yes, it is okay to participate. Now, when we move on to dilated and restrictive cardiomyopathy without features of hypertrophy, we similarly think about it in a similar approach. When we're thinking about competitive sports, we think, do you have any symptoms? Have you passed out for any reason? How is the heart squeezing, and any abnormal arrhythmias? The caveat being with the restrictive cardiomyopathy, we do additional testing, often with hemodynamic catheterizations, to make sure that the hemodynamics pressures in the heart and in the lungs are okay to proceed with exercise. But if all of these criteria are met, even if the heart is larger than normal, we often can still say that it's okay to proceed with competitive sports. And again, recreational sports are generally acceptable. But again, this is very important to have a discussion with your physician. And then we get into the area of hypertrophic cardiomyopathy. And I think this is an area that's undergoing a lot of investigation or consideration, both in the adult world and pediatric world, because we're not quite sure where we should be recommending exercise. And so generally speaking, in patients that have a gene for hypertrophic cardiomyopathy, but the rest of their cardiac evaluation has been negative, we treat them as if they have a normal heart. And so they're allowed to participate in competitive sports, and they're allowed to participate in recreational sports, making sure that we've done our full evaluation and do not see any concerning symptoms or concerning features. However, for patients that do show evidence of disease, at the current time, the guidelines state that patients that have hypertrophic cardiomyopathy should not participate in competitive sports, with the exception of low-intensity sports, the examples being golf, yoga, badminton. And so for patients that have evidence of disease, particularly sports that involve high-intensity or burst exertion, that is where historically we have been most concerned about participating in competitive sports. However, recreational sports, some levels of recreational sports, moderate or mild to moderate intensity, are okay to participate in. So when we're talking about recreational sports, as I've said, there's low to moderate intensity, and these are examples of low and moderate intensity sports that would be reasonable to participate in as someone that has hypertrophic cardiomyopathy, including cycling, jogging, hiking, swimming, doubles tennis, and then the low intensity sports, scuba diving, horseback riding. So there are reasonable sports to participate in. However, I do want to highlight that, as I said, this is an area that's really having ongoing study, and so things that you might hear about as you talk to your provider or read in the news. So why do we get concerned about hypertrophic cardiomyopathy? Well, it's because there is, we know, an increased risk of having sudden cardiac death in patients that have hypertrophic cardiomyopathy. Although historically we thought the rates were higher, in our current era, using all the data that we know, the risk that we quote is 0.3 to 0.5% per year of having an event. Historically, we had thought that hypertrophic cardiomyopathy was actually the leading cause of sudden cardiac death. But as I've said, in the current era, now that we know more and we're collecting more data from communities both in the US and internationally, we now know that it's not the most common cause and contributes to 3 to 10% of sudden cardiac death in athletes. And historically, so we know that hypertrophic cardiomyopathy does have this risk, but there's been previous thought that participating in vigorous exercise increases that risk of sudden cardiac death, and thinking that any burst exertion can cause a sudden rise in your catecholamines, your stress hormones, that can stress the heart and increase the risk of having arrhythmias. However, when we look at the most recent literature, we found that many times of sudden cardiac death that are reported actually occur during usual daily activities, at rest, or during sleep. So maybe our presumption that vigorous exercise may not be the only triggering factor and may not be the most important factor. So just a little more data going into what's coming out. So when we think about, is there a risk of sudden cardiac death when you have hypertrophic cardiomyopathy and you're doing exercise? Well, as we know, 4% of sudden cardiac death in youth are due to hypertrophic cardiomyopathy, but in this study, 70% of those patients were actually over the age of 20. And 50% occurred at rest or while they were sleeping. There was another study that looked at rates of sudden cardiac death in patients that had hypertrophic cardiomyopathy and a defibrillator, and they again found that defibrillator shocks did occur with activity, but they occurred at similar rates whether you were doing competitive sports or other physical activity. There was a recent study that came out that found that these events in patients that some were restricted from sports and others were counseled on the risk-benefit and allowed to continue to participate. There were similar rates of events in both populations. And then lastly, as Dr. Lin reviewed this morning, work from our colleague Dr. Day, who's now part of Penn, looked at a study of moderate intensity recreational exercise in adults with hypertrophic cardiomyopathy and found that there were no adverse events. So I think at this current point in time, we're uncertain whether sports participation increases risk of sudden cardiac death and hypertrophic cardiomyopathy and what magnitude it does. There is a lot of emerging data that we're excited to be see coming out. As mentioned this morning, the live HCM study. This is an observational study, so patients that have hypertrophic cardiomyopathy that are going about their daily activities and participating in whatever activities they want. We're observing them and seeing what happens and trying to learn just from seeing what people are doing, learning about the rates of these risks. There should be new hypertrophic cardiomyopathy guidelines coming out next year that are going to, again, be reevaluating where we are based on the most recent data that's come out and what can we tell our families and patients. And then lastly, we're hoping to start enrolling soon, as mentioned this morning, a similar study for moderate intensity recreational exercise for children that have hypertrophic cardiomyopathy. And if you have any questions, please feel free to come see me about that. So where are we now? What do you do as a patient or as a family? And so something that you can consider doing is what we call a shared decision-making model. This is where you and your doctor talk about the risks and benefits of ongoing sports participation and decide for you as an individual what makes the most sense to promote your well-being, quality of life, but also minimizing the risk that we can't quantify in this current era, what risk there is. And so when thinking about what activities you should be doing in this population, it seems reasonable. You can participate in light and moderate recreational activity. But when you're thinking about participating in vigorous or high-intensity competitive sports, we really need more data. And so this is where a shared decision-making model with your physician is very important. And feel free to ask those questions so that you can make the right decision for you and your child. So a question that does come up, what about thrill-seeking activities? What about roller coasters or trampolines? And we used to be able to say we don't know and we're worried, so don't do it. But there was actually a study just published earlier this year that found in adults with hypertrophic cardiomyopathy, thrill-seeking activities were not associated with rates of events. And so likely in the adult population, it's low risk. But I think this is another scenario where looking at each patient individually to say what risk factors there could be and individually deciding together what makes sense. So wrapping up, when we see patients that are thinking about pre-participation sports evaluations and considering participation in sports for any type of cardiomyopathy, what's very important is to have regular cardiology follow-up, as your heart disease could change as time progresses, to go through all of the evaluation, which may include imaging, evaluation of arrhythmia or blood work, and then most importantly, whenever you're participating in sports, whether it's recreational or competitive, always important to have an AED on site, an automatic external defibrillator, and to have someone that knows how to use it, to be watching out for warning signs that something might be off with your body, to stay hydrated, and to avoid exercising in heat, and to be able to take breaks or rest as you feel appropriate. So in summary, it seems that some degree of exercise is good for everyone, even those with cardiomyopathy, but there are some conditions where intense physical activity may be dangerous, and there are efforts underway to evaluate data and publish new guidelines on exercise in sports for those with cardiomyopathy. And it's really important to work with your cardiomyopathy team to assess what degree of exercise is best for you. And even with the current guidelines, people with cardiomyopathy still can engage in a variety of activities that can be heart healthy and fulfilling. So with that, I'll wrap up. If there are no questions, then I'll go on and introduce the next presenter. Yes?
I have a question. So, where would wheelchair basketball, and if they, can't run, but, they do... So, my son likes basketball, and he really likes to try and do wheelchair basketball. And we're kind of in a gray area because it's not regular basketball, but is it still where would that fall in these categories? Or if he's, doing a fun run and he's in his wheelchair wheeling, where would he fall in that? Low, intense, moderate, competitive, because, half his body isn't, being used. So just some thoughts there about where possibly that would be. Did you have an idea?
Yeah, so I mean, without knowing any specific details about your child's heart condition, I think general rules are what we talked about in the beginning, thinking about the levels of intensity. So even if there's not a full body participation, still how much exertion is being used? Are they able to still catch their breath, or are they really out of breath and huffing and puffing and pushing to full exertion, putting them in that high intensity sport? And then additionally, are they allowed to rest and take breaks when needed? So are they being pushed to compete at the highest level and are not allowed to take breaks when they want and are really being pushed beyond what they would do on their own? Then that would be falling into the competitive sport category, versus if they're allowed to participate, but if something feels unwell or they just want to take a break and take fluids, they're allowed to do so, then that seems to be falling more in the recreational sport category. And so I think it's a great question, and things are not clear-cut, and it's a great discussion to have with your cardiologist, but general thinking about it. Yeah.
Have you guys put together any brochures that would describe the difference between what constitutes a recreational activity and a more high-intense activity?
I think that's a great idea and something that we could certainly take on, particularly in partnership with the CCF, because I think there's a lot of gray zone and gray information. Yes. Okay. Thank you.
Thank you so much. I'm sorry. So just in the interest of time, I think this is a great, probably lots of questions. And thankfully, Dr. Burstein is doing a breakout session in the afternoon. So I would encourage everyone that has questions to visit her at the breakout session during that time. So thank you. I'm sorry to cut you short, but thank you so much.
Yeah. No, thank you. And I want to introduce my colleague, Dr. Deborah Lefkowitz, who's going to be discussing teen years and transition to adult care. She's been a highly valuable member of our team.